we're here at the Holtorf Medical Group with Dr. Holtorf to discuss the Endocrine Society comment on the fact that bioidentical hormones shouldn't be prescribed. So, Dr. Holtorf, the Endocrine Society recently came out with that statement, and let's go ahead and talk about what are bioidentical hormones.
So, bioidentical hormones are basically the same copies of what is naturally in your body. Instead of synthetic hormones, which basically they tweak the molecules and then they can be patentable. But when they do that, they basically oftentimes they'll show effect, but they have side effects that only come out significantly after they're put out. So, and that's what studies are showing in terms of breast cancer, cardiovascular disease, and effectiveness, that bioidentical hormones are significantly safer and more effective than the synthetic hormones that are typically used.
Okay. What about side effects with bioidentical hormones? Are there any?
So when you look at bioidentical hormones, and let's say for hormone replacement, and you look at especially the progestins versus progesterone. So progesterone is naturally in a woman's body, and progestins are tweaked.
Okay.
So what they do now, they were approved. The progestins were approved because they protected the uterus just like progesterone does. So normally when you get estrogen rise, endometrium thickens, and then progesterone stops that thickening. When it drops, you have a period. So they showed that basically progesterone will protect the uterus. But unfortunately, when you look at breast tissue, they're completely opposite. So estrogen stimulates breast tissue, progesterone stops that stimulation. So unopposed estrogen can increase the risk of breast cancer, and progesterone eliminates the risk. Now, progestins, as they work like progesterone does in the uterus, opposite effect on the breast. They stimulate breast production, breast cell differentiation and production. So what happens is the breasts are stimulated with estrogen and then made worse with progestins. So dramatic increased risk in breast cancer if you use progestins. I mean, some studies show up to 5 times the risk.
Wow, okay. So I know this is something that the Endocrine Society stated was one of the problems is that the FDA doesn't regulate bioidentical hormones and maybe the warnings aren't on there. What are your thoughts on that?
Yeah, when you look at, and it's commonly said, and it's just a scare tactic, and bioidentical hormones are more regulated than the FDA. And you look at the FDA is really in bed with the pharmaceutical companies. I mean, they're the same people. They're people on the same boards are monitoring. So it's basically, the chicken, the coyote guarding the chicken coop. But when you look, bioidentical hormones are regulated at the state level and under a lot of regulations. So they actually have more regulations than FDA approved. And for instance, FDA approved medications have a plus minus 10% in potency. So, but bioidentical hormones plus or minus 5%. So they're actually much safer, and even just the compounds are so much safer to begin with. I mean, you're definitely going to increase risk of breast cancer and cardiovascular disease with synthetic hormones. Well, bioidentical hormones will prevent that. And then you look at the potency issue, which they say they have to do testing, independent testing, and it's not an issue.
Okay. The Endocrine Society also put out a statement saying that while they're not recommending bioidentical hormones, it seems that more women are gaining benefits from bioidentical hormones versus synthetic. Would you find that to be the case?
That is absolutely the case. Women feel so much better on bioidentical hormones. A number of studies that I went and did a number of years ago, researched all the studies on bioidentical hormones versus synthetic hormones. Was published in postgraduate medicine, and it is still the #1 read article of all time in their journal. But reviewed all the studies, and it showed every study that compares bioidentical to synthetic shows greater satisfaction, greater efficacy, things like increased sexual satisfaction, less bleeding, better symptomatic control, depression, so many things, they're better. And also, all the studies show significant increased risk of breast cancer with synthetic hormones, reduced with bioidentical hormones, as well as cardiovascular disease. Do you want to increase cardiovascular disease? If you do, take a synthetic hormone replacement. If you want to prevent it, take bioidentical.
Okay. What about bioidentical hormones and their ability to maybe come in different forms? So I think they're better used for different patients. Is that correct?
Yeah, and you can certainly customize. And when you look at one thing I think with a lot of bioidentical hormones, based on Jonathan Wright's study, which he's great, but I don't think the study was absolutely correct. where he says 80% estriol and 20% estradiol. Now, estradiol is the standard estrogen, standard potency. And there's two estrogen receptors, A and B, and or alpha and beta. And basically, estradiol it will stimulate both of those same amount, 1-to-1 ratio. Now, with the A or the alpha will basically stimulate breast cancer proliferation, and B will prevent it. So estradiol is neutral in terms of, but estriol is selective beta, so it actually prevents breast cancer. So people put a lot of estriol in it, but it also blocks the estrogen effect. So people sometimes will say bioidentical hormones didn't work for me because there's too much estriol. So we found that adjusting that ratio, and for different people, different amounts, that we can get much more effectiveness and be safer.
Okay. And one of the last questions is it affordable? Would you be able to find this for a good amount in comparison to the synthetic hormones?
And when you look at the actual cost, they're much cheaper, and usually $40 a month or so. Now, insurance companies started not covering them oftentimes, and again, it's just all because they're in bed with, the FDA and the pharmaceutical companies. But in terms of actual cost, they're much cheaper.
Okay, well, thank you so much, Dr. Holtorf, and for more information, visit holtorfmed.com.